Welcome to Community Health Matters. I'm your host, Amy Marsalis. On today's show, we're going to discuss suicide awareness, affordable dental care options, and computer-aided joint replacement surgery. All of that coming up next on Community Health Matters. From the News Channel 5 network, this is Community Health Matters, sponsored by the United Health Foundation. Hi everyone, so glad to have you join us today. First off, I want to say that September is the month that's dedicated to Suicide Awareness Month across the country. Very sad, Dr. Fiscus, that we have to have a month dedicated to bringing awareness to this subject, but important that you're here to discuss it with us. So thanks for coming in today.
Thank you.
Why is there such a prevalence of suicide, particularly, as I understand it, here in our state?
We have a higher than the national average prevalence of suicide, quite a bit higher actually. And what many people might be interested to know is that our most at-risk population are white males between the ages of 45 and 65 who might be turning to suicide because of economic downfall, because of relationship issues, because they might be a population that is a little reticent to get help or might be embarrassed about talking about the need for mental health. So it's really important to have platforms like this where we have an opportunity to raise some awareness around the trouble we have with suicide in Tennessee.
Why in particular, though, in Tennessee? Is it because at least in the Nashville and Middle Tennessee area, it seems like our economy is strong, but what accounts for this high number?
Well, we know that many of the suicides that occur happen in rural areas, and Tennessee is a pretty rural state. We don't always have behavioral health resources available to people who live in smaller counties or more rural areas who might have to drive a significant distance or may have trouble with insurance covering behavioral health services. That's a big problem. And then there's, I think, maybe a little more of a perceived stigma around mental illness in the South compared to other areas of the country that might be a little more receptive to understanding that mental health is just another part of physical health. And when we cut the head off from the rest of the body, then you know, unfortunately we start to lose that need for complete person health that we have.
What about, okay, you're a pediatrician, so I know you're here to talk about prevention among youth, among kids.
Right.
This is just such a sad state of affairs. I know there was a story recently over the summer about a 10 or 12-year-old little girl, not in this area, that took her life. Why are you seeing more children?
There's been a huge uptick in youth suicide and in youth suicide attempts. Those numbers have tripled over the last 5 years. And we're now losing a child in the state of Tennessee about 33 times a year, which is, I mean, that's a lot, you know, 1 every 10 days or so in our state. Part of it's social media, you know, something that we didn't have when we were growing up. Now these children see their friends on social media who are portraying the absolute most precious, perfect picture of themselves, and those children may not be able to see themselves that way. And also it provides a channel for bullying and sometimes anonymous bullying, where children are just so young that they don't really know how to cope with that or find resources to help themselves.
Is that something the state is engaged in with schools, school administrators, teachers on preventing the bullying epidemic?
Yes, well, the Department of Education has worked very hard on bullying within schools, and then also the Tennessee Suicide Prevention Network works very closely with schools, and we're actually the first state in the country to have a law that requires every school in the state to have a prevention, intervention, and post-intervention suicide plan in their school. And that is a combination of a couple of different laws over the last several years that have come into play. But this most recent iteration was just signed by the governor in 2016. So hopefully we're going to see more on the front of confronting bullying, but also being proactive around suicide in the school system for these younger kids.
What are some of the signs, symptoms that you tell parents as well as teachers to look out for among these kids that are at risk?
Yeah, the great thing is that we all know someone, right? So if everyone is watching out for everyone, then this might be something we can get ahead of. So if you have a youth who becomes very socially isolated, it's normal for them to want to be up in their bedrooms as teenagers. That's where mine are. But if they're no longer engaging in any kind of social activity, no longer enjoying the things that they used to do, they've dropped out of their sports, they're no longer going to the football games on Friday nights, early substance abuse, alcohol use, especially under the age of 13, if they know that their child's being bullied, and then in even older people, if they don't have stable family relationships, stable social relationships, in older folks, if they're starting to give away their possessions or being much more withdrawn, then those are definitely warning signs, and it's much better to speak up and talk to that person or try to get them help than to think it's going to go away by itself.
I saw the list. I don't know if we could pop that up again, but the first thing on that list said wanting to die, them talking about it.
Right.
So that, I'm surprised that children would even verbalize that, but some do.
Some do, and it's hard in youth to discern that sometimes because, you don't let your daughter go out on a Friday night somewhere and she might in a huff say, I want to die. And that's not the same as a child who, out of some other kind of circumstance, says something like that. So parents can justifiably have some difficulty figuring out how seriously to take those kinds of statements from their children. And probably the best thing to do is to call their pediatrician or their child's health care provider and discuss that with them and run it by them and see if maybe it's time to get some professionals involved.
Okay, and as we wind up here, for someone who may be contemplating taking their lives or feel they need help, where should they turn?
There's a couple of really great resources. There is a texting service, so if they're shy about calling someone or not sure what to do, they can text to 741-741 and text in TN and immediately get a response from someone that can help them with their feelings about suicide and get them connected. There's also a national hotline, 800-273-TALK, that they can call to get someone, and that's their 24/7, 365 as a resource.
All right, Dr. Fisk, it's a tough subject, very delicate subject, but one we need to talk about because, as you said, mental health is every bit as important as the rest of our body.
Exactly
Yeah,
right.
Thank
Thanks
you
so
so
much.
much. All right, we'll be back with much more right after this. It's my pleasure to introduce Katina Beard, with the Matthew Walker Comprehensive Health Center, talking about dental services for people in our community. You've been around, not you, but they've been around in our area for nearly
almost 50
half a
years.
century.
Founded in 1968 by Dr. Matthew Walker, who was a surgeon at Meharry Medical College at the time.
Okay, and it has evolved over the years to provide a variety of services. So tell us more about it for people who aren't aware of what all you provide.
Yeah, so we are comprehensive, hence our name, Matthew Walker Comprehensive Health Services. So we have medical services, dental services, diagnostic services with radiology and lab services. We have behavioral health services, case management, outreach and education. We have a pharmacy in our national location, just a long list of services. We have nutrition, which also includes now a food bank for people who need access to food.
Wow. So started originally to provide services for people who had no insurance.
Yeah, so it was started in 1968 in North Nashville, primarily for North Nashville residents. It served as a place for people to receive care, for people to be employed, for people to receive additional services that were not always met at the doctor's office. And so we've really kept his mission and his vision alive because we trained several students through our facility, several residents and different disciplines, clinical and non-clinical. We try our very best to employ from the Nashville community to put back into our community. And we've continued our mission to make our services comprehensive and affordable to those who are uninsured.
So, and it's based on a sliding scale.
It is. It's based on a person's income. So they would bring in their income, some verification of their income, and tell us how many people live in their household. From there, we would determine what their eligibility is, and that would be their eligibility to pay. And all of our services are based on an individual's income.
Okay, tell me more about, let's talk specifically about the dental care. I know that's what we want to focus on primarily today.
Yeah. So we have a dental clinic in our Nashville location and in our Clarksville location. We provide, I would think, a full array of dental services in our oral health program. And so we have a hygienist on site, and so you can get your teeth cleaned, and we have dentists, and so we can do simple extractions, some more difficult extractions. We do basic root canals, of course, fillings. We can do crown work, partials, dentures. We always want to keep our children's teeth clean, so we want to do fluoride and sealants on those teeth to make sure that they stay healthy. So we're able to see the entire family for their oral health needs.
That is fabulous. Why does dentistry play such a big role in our overall health? I've always heard that it's very important to our heart health because of all the bacteria in our mouths.
Yes, particularly for our patients that have hypertension or heart disease or diabetes, because the oral health and the disease in the gum can affect their blood sugar or their blood pressure in many ways, and it just leads to other different diseases in the body. And so we want to make sure that the teeth are healthy and that the mouth is healthy.
And earlier you start obviously teaching good preventive methods
Absolutely.
as far as flossing,
brushing, flossing, coming to the dentist twice a year. People kind of want to just only come when there's a problem, but come beforehand. It is definitely something that if you are preventive and preventive minded about, it would be much better in the long run.
Absolutely. How do you coordinate the dental services with other services that the Matthew Walker Centers offer?
So we are an integrated model, and so our dental services and our medical services, radiology, all those services I spoke about earlier, are all integrated into one building in Nashville and in Clarksville. And so our patients just go from one floor to the next, and so they never have to leave our building to receive a lot of the services. And so that's what's unique about what Matthew Walker does, in that we house a lot of our services in one location, and that is a cost savings to the patient. It's a cost savings to the insurance payers because it's not all that additional coordination of care outside of our walls. And so it's really a great model that helps all around.
Describe, if you could, I don't want to say your average, your typical client, but if there is that person that you see more of, is it someone elderly? Is it
the majority of our patients are older adults. I would probably say, I don't want to be offensive, but 50 and older. I know people 50 is young, so 50 and older I think is our highest number of patients that we see. A lot of them are working but uninsured, and so they're able to receive care and pay for their services, but they just don't have coverage. And so we want our services to be available to people so that they don't end up in the emergency room with this extensive cost unnecessarily. So that's our average patient. We also accept insurance, and so we want people to know that we accept their insurance also, and they can come into this integrated model of care also.
Okay, so again, it's not just uninsured,
It's not
but
just
underinsured.
Underinsured, uninsured, and fully insured. And so we're there available to our community in Nashville. We know our neighborhood around us on Jefferson Street in North Nashville is changing, but we want people to know that we're there for the full community, to keep the full community healthy.
You mentioned Clarksville. Where else are you?
We're in Clarksville at 230 Dover Road in Clarksville, and that has medical and dental services. And then we are in Smyrna at 739 President's Place, and that is our medical office, which is largely our prenatal care program, which is a wonderful program with all of our new moms. And we also have adult medicine, and we just have most of the services there except dental.
Are they able to get in fairly quickly for services? Is there much of a waiting? You know, so many physicians' offices, you have to wait a while.
Yeah, now honestly, dental is a little bit of a wait because we have a lot of people needing access to affordable dental care. And so we do have just a little bit of a wait, but we have 3 dentists in Nashville and 1 dentist in Clarksville, and so we could get people in pretty soon. Once again, come before you're in a lot of pain, and they can always give us a call for all sites at our main number at 615-327-9400.
9400.
Yes.
Okay, and I know we've been putting up the website under Katina's name
Yes,
throughout the
they can go
the
to the
segment.
website and get more information. Send us an email. We'll reach back out.
Great. Katina, thank you for enlightening us because I had not heard of it, which means, you know, I'm sure a lot of our
Yeah,
viewers
yeah,
haven't. So
yeah.
thank you for educating
you.
us and
I
for all the
appreciate
good
it.
work you're doing.
Thank you.
All right.
Thank you.
And we'll be back in just a moment. We're talking about history being made in the field of orthopedic surgery, joint replacement surgery, in terms of what you have accomplished, Dr. Hodrick, being the first surgeon to perform a knee replacement with robotic technology. Elaborate on this. Tell us what you've been doing and how many patients you've done.
Sure, it's exciting. It's fairly new technology for knee replacement. You know, there's robotic technology that's been in orthopedics for partial knee replacement as well as hip replacement, but that technology now offers blade technology. So we use a saw blade to perform a knee replacement. So during this procedure, I'm able to use that blade to perform the knee replacement. I'm excited about the technology. I've been able to do about 20 cases here at Centennial Hospital, and I'm excited for our patients here in Nashville and the surrounding areas.
Who does this serve the best and why?
Sure.
What patient would be eligible for this?
Anyone really that's eligible for a knee replacement.
Okay.
You could argue, but some of the patients with the worst disease, perhaps with the most crooked knee, would benefit even more, because I believe there's tremendous benefit in some of the alignment technology. You know, we actually use it to be more precise during the surgery, and we're able to line up the knee both in the preparation as well as during the surgery.
So that's what makes this better than the traditional way of doing it.
I think there's several benefits. So as a surgeon, I like to do as much as I can before surgery to make sure things go well during surgery. So with the robotic technology, we obtain a CAT scan or a CT scan of the knee. So instead of using a two-dimensional x-ray, we now have a 3D custom, it's that patient's knee, virtual model that we're able to template or plan the surgery ahead of time. Then during the surgery, we actually get information that's dynamic. So I can move the knee in space, and the computer software tells me where everything is and where I want to make the cuts before I make the cuts. And then finally, the robot assist actually helps me be more precise. So whereas a surgeon, we think in millimeters, the robot thinks in 1/10 of a millimeter. So it's that accurate.
Okay. I mentioned this to you earlier off camera about doing some stories in the past on the use of robotics and other types of surgery. It was prostatectomy, where the surgeon was at the joystick, if you will, on the other side of the room. You said you're in the same field. Explain that.
That's great. It's more of a tool. So I'm
Okay.
still scrubbed into surgery. I'm still controlling the robot. The robot doesn't control me, not yet. So I'm using this as a precision tool, basically, to execute the surgery. So that robot's right next to me and allows me to perform the surgery. So I'm not away from the field at all. I'm there performing the surgery.
Is this technology just for knee replacements, or can it be used for other joints?
Yes, in orthopedics right now, it's available for knee replacement, partial knee replacement, as well as hip replacement. But I think in the future, as if you look at any industry that robotics is involved, I could see this technology being used in shoulder replacement, ankle replacement, spine surgery, where it's also available. But as far as joint replacement right now, it's just around the knee and the hip.
Okay. What are the most common types of joint problems you're seeing in your practice these days?
Sure. We see mostly arthritis. So arthritis, of course, is that mechanical wear away of the cartilage. Patients end up having a stiff, painful knee, limits their activity. That's what we see most in our clinic because we perform joint replacement.
Okay. Is there anything you can do to help prevent the need for a joint replacement? What we can do if we're active, exercise? How can
Yeah.
we help ourselves
Well,
prevent
there
ourselves
is.
from getting in your, in your operating room?
Yeah, I think the best thing is to stay active. So, find a way to stay active throughout their life. Now, some of arthritis is pre-programmed, meaning it's genetic, but you can do things like keeping weight off and keeping muscle on and doing weight-bearing exercise. We know that that helps joints. There's some other medicines you can take that doesn't really keep away arthritis necessarily, but maybe controls inflammation. That may help as well. You want to probably avoid any large injuries, so we don't necessarily recommend high impact or extreme sports, perhaps for older generation.
For the older generation,
Correct.
okay. How do you know when it's really time to have surgery? Because obviously that's usually the last thing you want to do as an individual is to have surgery. How do you know when it's time?
Yeah, it's a lifestyle decision. So when it starts making decisions for you, so if your knee keeps you from doing something or going to a restaurant or going to church, if it bothers you every day, it's really kind of your quality of life. If it bothers your patterns of sleep, or maybe there's things you can't do or things that you want to do, get on the floor with your grandchildren. We hear that all the time. That's when you know it's time at least to get an evaluation, have an x-ray.
You mentioned also before we started on camera about doing a knee replacement on someone in their 90s, which just blows me away.
Yeah.
And you made a comment about a very cool group of senior citizens who are so active in our state.
Yeah,
Do you think we're unique in that way as Tennesseans, or just what you're observing?
I think from my observation, yes. We have a really neat elderly generation of 80s and 90s that are extremely active. And honestly, if you look at probably health in general, if you can get past your 60s and 70s into your 80s, you have a good chance to make it into your 90s. And the 90-year-olds and 80-year-olds that I've taken care of I don't like to play favorites, but they're some of my favorite patients because they're extremely active. And they want to continue to be active, but they have knee arthritis. So there's different ways to help them.
And they probably listen to you too, right?
They do.
They're compliant.
Typically, yeah. Typically, that's another reason why they're my favorite patients.
Yeah. Okay. How do you find out more information about this new technology for people who are just interested in reading about it or learning more?
Sure. You can visit our website, www.sjri.com.
All right. Thank you, and congratulations.
Thank you very much.
On this. You've made history.
Thank you. Thanks for having
Wow.
me
We're
on.
lucky to have you
Thank you.
in Middle Tennessee. All right. And we'll be back in just a moment. Thank you for watching Community Health Matters. Learn more ways to improve your health at mycommunityhealthmatters.org. And remember, here in Middle Tennessee, our community health matters.